Within 2 days, the fever was growing very fast, up to 103 and a half, rising like every couple hours.
I don't know if you ever had that feeling before. I just felt something was seriously wrong. And she was like, they just airlifted your brother. I'm like, what? She said, yeah, the ambulance picked him up and he was airlifted to the medical center in Jackson.
Now, just because these patients are positive, they do not mean they're stable. So if I have 7 patients and 4 out of the 7 are dying, what kind of shift you think I'm about to have? I can't, and I'm not an octopus.
What was crazy about it, not only did I try and, pray more for myself, but it made me think about other people that maybe was going through this or even worse or, even less of what I was going through. No matter what, it still just made me want to pray for everybody and make sure everybody was okay. No matter if they had what I had or if it was worse than what I had.
My name is Yolanda C. Ellis. I'm an educator. This is my 25th year teaching for Broward County Public Schools. On the collegiate level, this is my 16th year. And I'm also an event designer, once by Yolanda.
That's great. During this pandemic, we was told about the unfortunate loss of one of your family members. Can you just tell us their name and, just give us a brief description of their personality?
My brother, his name was Andre Lamont Smith, aka Pookie in my eyesight, and Juicy, with all of his friends. He was 51 years old and he passed away January the 6th at the University of Mississippi Hospital in Jackson, Mississippi. And he was a sweet person. He loved working on cars. He would just make you laugh all the time. And he did have an underlying condition. He had diabetes, and he was a recipient of a kidney transplant.
As far as diabetes is concerned, is there a history of diabetes in your family?
There's not a history of diabetes in my family, honestly, but hypertension, high blood pressure. But and I don't really think genetically it didn't start from that, and I don't even think it started from eating. It's just the atmosphere. Who knows? We really don't know. But yeah, diabetes.
And at what point did your brother start to notice that he wasn't feeling like himself?
Well, my brother lives in Mississippi. I'm the only one that's here. I'm his only sister. I have 3 brothers. Well, now I have 2 now since he passed away, and I was told that he was feeling ill. So my mother called me one Thursday night on the phone, and she was like, Pookie is very sick. So I called his girlfriend, Tangi. So on that Thursday, December the 11th, and I remember so well because my husband is a diabetic, and he was on his way to see Dr. Murray, who's an eye doctor in Miami, and my brother actually goes to see him as well. And my sister-in-law called, but I don't know if you ever had that feeling before. I just felt something was seriously wrong. And she was like, they just airlifted your brother. I'm like, what? She said, yeah, the ambulance picked him up and he was airlifted to the medical center in Jackson. So I called my mom and dad. They were waiting for the helicopter to actually pick him up. I was so stressed out about it. And the hospital was so inundated with patients. They didn't have space for him, and he stayed in the emergency room. The ICU, they made that an ICU for like one day. And I was just so stressed out about it. And my parents are elderly. Of course, I was the one put in charge of speaking to the doctors about my brother, and honestly, they could not give me any answers about it at all. the doctors was like they never seen anything like it before. They actually wanted to have permission for me to ask my parents for permission to take samples from my brother. They didn't say a sample of his blood or a piece of his tissue. I just didn't know. My mother said no. But you just never know what happened in that situation. And he was placed on a paralytic drug to be paralyzed. And I called to check on my brother. And honestly, a lot of the nurses, they were just like joking around, laughing. I'm like, what the hell is going on? Honestly, I don't understand this. And I'm like, how's my brother doing? Because I actually have documents from the first day he entered into the hospital. And it was like, oh, he had a bad night. He's not doing too well. I'm like, what do you mean he had a bad night? I don't understand. But they just kept him drugged up so much. And I believe he fell out of the bed. My baby brother had the opportunity to go to the hospital to visit him. And we did like a FaceTime. And I saw my brother lying in the bed, lifeless. His eyes was just glued shut. I'm like, why are the doctors not taking care of him? He just looked like he wasn't taken care of. They were just so inundated, and he passed away. And well, actually, that before he passed away that morning, we had an opportunity to talk to him, and it's the worst experience of my life. When my brother passed away, honestly, my heart, my soul, every piece of me died with him. It's the most hurting feeling I've ever experienced in the 51 years of my life. I've gone through so much. And I miss him every day. I'm in therapy. I went through EPA, the school board. I had to, because not just dealing with him, my husband is ill as well. My mom and my dad, they're elderly. My dad is suffering from dementia, and there's just so many factors. And I had an opportunity to go home over the summer, and I spent every day at this gravesite. It's like I'm in a dream, honestly, and I need to wake up, but it's not a dream. And honestly, I have here, and my heart, every day I cry. I made this box, and my therapist had me to make this box. And whenever I think of him, I can write statements, I can blow kisses, I can do whatever I choose in this box because this is my box. And I miss my brother so much. Right now, I don't have any papers in that say I love you, but I open it up every day of my life because I'm very close to my family. And I have his necklace. My nephew gave it to me. It's a cross. He'd had it for years. I need to get it adjusted. I'm going to start wearing it every day. It's so special to me. And I designed a Christmas tree with scriptures from the Bible while he was in the hospital. And this particular one says, Lord my God, I called to you for help, and you healed me. Psalms 32. And that's the new version of the Bible. And this is his picture right here, and this is an ornament. I have other pictures and videos, but I miss my brother so much. This virus is very dangerous, and I am a research scientist. We really don't know what this is. And I knew he was sick from his kidneys and his diabetes. He lost his sight, and maybe he really just didn't want us to know how he was feeling this particular time. And the virus just took over him. It just took him from me. It's the hardest thing, again, I've ever experienced. Lord knows. Every day I just say, I want my brother back. I want my brother back. I hate looking at the news just to see people dying because of this. It's hard. It's really, really difficult. If I could just get him back, and I know we all have to die one day. I know those things. But I don't know what this virus is. No one does. And it's so scary. I miss him very much. So I want to write things and put in this box. If I just want to open it up and have my mama with my brother, I will, because this is my box. And can't anyone take that from me. No one. This is my special box, and I have my time with him. If I want to cry, I want to cry. And my heart goes out to all the people in the world who have lost loved ones because of this. I just wish that everyone just take heed to what scientist says. I'm a research scientist, and I truly believe in that. Wash your hands, practice social distancing, wear your mask, and protect yourself, because we don't know what it is.
Around the time your brother started to feel ill, what kind of symptoms did he start to notice?
Well, basically, my brother lost his vision due to the diabetes. Diabetes is very serious. It actually attacks different parts of your body. He also had his toe amputated because of the diabetes. So I think he was really sick from that, but he just would not express himself to us because he wouldn't want my mother to worry, nor would he want me to worry as well. I feel that they did try their best, but they were just so overwhelmed and inundated. They just didn't have that time to do that one-on-one. And the thing that I think for me that really, truly affects that person who's ill on that bed is not seeing their loved one, because you're not allowed in that hospital to be with them. My brother was put in that hospital December 11th. He came out in a body bag January the 7th. And I know in his mind he was like, where's everybody? Although he's on a paralytic drug, I knew he could hear our voice when we had an opportunity to speak to him. And I think that's with any loved one. And that's why I see stories where the husband and wife both are hospitalized together and they die hours apart because of that spiritual connection. There's no one there. Your loved one is not there. And I'm sure he was lying in that bed saying, where's my family? Because I feel that if we were there, I would make sure I brush his teeth, comb his hair, wash his face, oil his body. Because they were so inundated, they don't have time to do that. And he wasn't taken care of properly. He wasn't. And I'm sure he could hear everything that those people were saying. That's hard. That's difficult.
Were you aware if your brother Pookie was vaccinated or not?
My brother was vaccinated, I believe. Or he had taken the first injection, I believe. Yes. I've been following Dr. Fauci for years. I really respect him. You know, a lot of people don't believe in science. I'm a scientific person, and I do. And I think when we take those precautionary measures, like wash your hands, wear your mask, and just try to stay safe, and don't just be around a large group, because honestly, you don't know who do or don't have COVID. People may say, oh, I'm okay. You just don't know. It's pretty scary. It really is.
How's it going?
We shaking and jiving.
Who do I have the pleasure of speaking with today?
My name is Brittany.
Brittany, you mind telling us a little bit about, how you became a nurse and like what university and everything you went to get your degree and everything?
Okay, so I became a nurse about 2 years ago. Yeah, it'll be 2 years soon. Oof. Thank you, Jesus. But I actually went back to school. I have my bachelor's in something else, and then after I graduated, maybe a year after that, I went ahead and went to Miami-Dade College. Shout out to NDC. And I went through the accelerated program, which was very, very tough. But that is my educational journey on how I became a nurse. But personally, I was influenced by my grandmother. late grandmother. She passed away in 2014, but during the last 11 years of her life, she was very, very sick. And I have a special gratitude and appreciation for the nurses and the doctors that stood by her side and helped her to her last days. And I knew that I had to carry on that mission by doing the same thing that they did to my grandmother.
And can you just explain to us, like, what is COVID and like what parts of the body does it attack in a sense?
Okay, so definitely respiratory. That is number one for sure. And once that goes down, any other system in your body can diminish quite quickly. So working as a nurse in the pandemic, honestly, when COVID first came about, it was my first year of nursing. And actually, I was just off of preceptorship. So every nurse knows that once you do get hired by a hospital or whatever place that you are working for, you have to have a preceptor. And that person pretty much shows you the ropes of how it is to be a nurse at that particular place. So I had just got off the preceptorship, so I'm still a baby nurse, trying to find my way through. And my very first shift on my own, I was in COVID, and I cried. And at this was the early moments of COVID where people didn't really know what it was. There wasn't a lot of PPE. I wore the same N95 mask when I had to come to work at least a month and a half to 2 months. Because they didn't have anything for us. Not enough gowns, not even enough hair nets for our hair, especially for my black sisters. We need stuff big enough for our hair. I had to start wearing satin caps and bonnets because I'm not going in there with anything, exposed. I have to keep myself covered. And like I said at that time, it was crazy how everything was just emerging and still there just wasn't a solidified answer on what this was about. But y'all want us to suit up and go in and take care of people like this. Right. It was a very, very scary time. And I remember a lot of nights, because I've always worked night shift, I just cry in my car. They say the first year of nursing is tough, but I feel like any nurse, especially if it was your first year of nursing working through a pandemic like this one right here, hats off to you. Because it definitely started to diminish my love for nursing after a while.
Over time, we had started to get a lot of research about COVID and everything. And what did you sense to people? Like, how does it get to other people?
Well, I'm not here to preach about masks and the pros and cons about masks, but I will say as a healthcare professional that masks do, lessen the risk of you contracting the virus. Is something that you can inhale. That's why we want you to wear a mask that cover your nose and your mouth. Just because your nose is covered, anybody has anything that comes out of their bodily system, you can inhale that by your nose or your mouth. So it's very important to keep those two covered. For me, in my opinion, that's the number one way of catching it, as well as just not washing your hands and just touching things and not keeping it in regard that you are around people that may not be taking care of themselves as they should be.
And can you just walk me through, I guess, a normal procedure of like a serious person who has like a serious case of COVID, and like what do you guys like first test, and what is the first thing that you guys look at when you first come in?
So normally in the ER they would do a rapid test. A lot of ERs are trying to get away from that. It depends on the hospital, because some hospitals have units for PUIs, which are people that they think that they may have COVID, but their test is taking a little bit longer for the results to come in. It's not a rapid. But at most hospitals, they don't have a PUI unit. They only have that COVID floor for people that are positive. Now, there have been times where they test people and it's false positives and false negatives and stuff like that. So at that point, you just have to take full precaution before even going to anybody's room. Regardless if you're working on a COVID floor or a non-COVID floor, at this point, you have to assume everybody has COVID. That's to keep yourself safe. I forgot the question.
Well, the question was, what type of test do you guys do when they first come in?
Oh, so it's mostly the nasal test that we do. That's the most definitive.
All right. The patients that you have had, how much is it like of your responsibility to recommend to them about the vaccine, to get the vaccine? Like, is that a big responsibility for you guys?
It's not a nurse's responsibility to educate patients about the vaccine or encourage patients to get the vaccine. All we can do is provide all information on what your options are to best combat this disease. That's it. So.
How does it feel when you have like previous patients who didn't get the vaccine and they end up back in the hospital? Is
bother me because just because you have the vaccine doesn't mean you're 100% covered. So when somebody comes in onto the unit and they're positive for COVID, I don't know how they got it. That's not really my concern. My concern is now, if you are a patient assigned to me, I'm your nurse for the next 12 to 13 hours, I'm doing everything that I can to preserve your life. That's what I care about.
What type of things are you hearing from like unvaccinated people as far as like the reason that they haven't got the vaccine? Like, is this
Not enough research.
Not enough research.
Not enough research. And then you have to think about, yeah, it's great that for specific ages there is a vaccine out there available, but what about the kids? And we already know that kids' immune systems are, it takes a while for that to develop. So if there's nothing for the kids, this is going to continue to circulate and circulate and circulate.
Being that the numbers are like picking up, I guess, do you guys have enough staff for the COVID patients? And like,
Absolutely not.
Absolutely not.
Absolutely
In those cases, like, what do you guys do, especially like when you run out of rooms and stuff like that?
We have to take unsafe ratios. So I can tell you, when I first became a nurse and when COVID started to become a big thing, the ratio was 2 patients to 1 nurse. Over time, 3 patients to 1 nurse. Okay. All right, we're getting into the groove. Okay, not too much. 4 patients to 1 nurse. Okay, that's fine. Now we're getting up to 5 positive patients to 1 nurse. And at that hospital that I was at the time, they were okay with letting you go up to 7 positive patients. Now, just because these patients are positive, they do not mean they're stable. So if I have 7 patients and 4 out of the 7 are dying, what kind of shift you think I'm about to have? I can't, and I'm not an octopus. I can't be at each deathbed at the same time. Having high ratios like that allows for a lot of things to get slipped into the cracks, and that's how things happen,
So,
unfortunately.
When you guys run out of rooms, what do you guys do, like with extra people who have COVID? Like, is it a hallway type of situation?
I have seen hospitals turn their auditoriums into hospital rooms. They're gonna make room. I can tell you what they don't have enough of.
What's that?
Morgues.
Oh, the morgues. Yeah,
So there's a lot of freezer trucks when you come to work or come out of work, depending on what time you're coming. Don't have enough space for the bodies.
So what race and age group do you mainly see while you're at work?
Age group?
Yeah, and
All.
like race as well. Oh, okay.
All.
All age.
I mean, I don't work in pediatrics, so I don't know about the kids. But the hospital I do work at does have a pediatric COVID unit. And I can tell you, I hear codes on the overhead all the time that kids are not making it. But at least when I am floated to the COVID units, I see all ages. I see people as young as 30, and sometimes you have people as old as 94.
So it just doesn't matter.
It definitely varies.
What about race? You see a lot more black people in a sense?
Honestly, it's a mix too, believe it or not.
Right.
A lot of people, from the islands, a lot of white people, there are black people, Hispanic people, not too many Chinese people, but it's definitely a big, diverse group.
Right.
Doesn't discriminate, that's for sure.
Do you feel like the hospital is doing everything they can to keep you guys safe as far as the nurses go?
No.
What would make you, I guess, feel more safe in a sense?
Well, first, the respect for nursing has gone out the window. That needs to be brought to the forefront first. Because if you make nurses feel like we're appreciated, we have no problem working. If you pay people at a certain rate where they're able to have an affordable life, a decent life, we'll come to work. That's the issue. You don't have enough workers because you don't want to pay. So because we're short every night, that's a lot of wear and tear on a nurse. That's partially why a part of me was like, maybe I need to sit this out until this blows over, because it takes a lot of wear and tear on me. Don't nobody want to come to work every day. Well, in this case, 3 times a week for a nurse, 4 if you want to do overtime. You come in and you realize there's only 5 nurses and 40 patients. Now, how you supposed to navigate through that? Every time you come to work, there's a problem. There's something that wasn't done the previous shift. Now it's your problem. It's out of your hands. It's a lot. It's a lot.
Have you gotten the vaccine shot at all?
I have not.
You have not? And is it because not enough research, or is it because of,
not enough research to me. For me, it was whipped up pretty quickly. Obviously, I'm not a doctor or anything, but vaccines have taken longer to develop. A lot of vaccines for diseases that have been eradicated now. I just feel like for a vaccine to have been produced this quickly, and how much push there is to even get it, I feel like people should make their own decisions and be respected for the decisions that they make. If you decide not to get vaccinated, do what you got to do to stay safe anyway. If you did get vaccinated, hip hip hooray. Continue to wear your mask though. That's how I look at it. But for me, it's not enough research. So if I'm not sure about something, I'm not putting it in my body.
Is there the people that's vaccinated, are they dying more, or the people that are unvaccinated dying more at a higher pace, I guess, in a sense?
That's also hard to say too, because even though when they come to the ER and we ask, we don't know if it's truthful.
Right.
But to be quite honest with you, of course, there are more unvaccinated people that are not taking precautions that are dying more of COVID versus those that are unvaccinated but are taking those precautions, and then people that are fully vaccinated. I can say that.
Okay. I think that's everything.
Oh, wow. Okay. That was
we
fast.
appreciate you too. You know
Yeah,
what
no
you're doing.
problem.
It's
Thank
serious
you.
what you're doing, and we just hope you stay protected, do everything you can to stay safe.
For sure. I'm going on an extended vacation next month, so
You need that.
won't be no nursing for a
I know
minute.
y'all
Yeah,
put in a lot of work right now.
for sure.
We appreciate you. Thank you so much.
Thank y'all. Thank y'all. This was dope. Thanks for having me.
Well, my name is Jamari Sterling. I'm 12 years old, and I grew up in Fort Lauderdale majority of my life.
When you first heard about COVID, whether that was from your friends or from school or the internet, did you think that it was going to be as serious as it is?
At first, no, I didn't think it was going to be as serious as it is now, how globally, how everybody, is getting everything, everybody's dying from it. I didn't really think it was going to be in this position, because I actually found out about it because when I was in recess in 5th grade, a piece of dirt got in my eye or something, and I started rubbing it, and my friend told me, don't rub it, because it's a way you could you could spread COVID throughout your whole body. But I didn't understand what he was talking about, because that was when it was only in China. But then as time progressed, it started getting worse over the whole world, and it became how it is now.
What are some of the things that seen on TV or read on the news? Did you see a lot of people dying?
Yeah, I just seen a whole lot of people dying. I was just confused, so I just started watching more and more, and I understood what it was, where it started from, how people was catching it, what are symptoms. I just started researching everything, make sure I was okay, make sure everybody around me was okay, and just doing my research on it.
So you did have corona at a point in time?
At a point in time, yes, I did. After I think about 2 years, eventually it happened to me, but I had a certain strand of it, which is Omicron, I think that's how it's pronounced. And I had that, which basically just attacks the bones and the joints, and it just gives you a lot of pain in your muscles, and just barely able to move, and just inflicts a lot of pain on yourself.
When did you, I guess you first felt yourself becoming sick in a sense?
Well, I first felt it. It was on a Wednesday on the school week, and after I was done trying out for football practice for my school, I thought me and my family, we just thought it was a regular, soreness from trying out, probably out of shape or something. But as time progressed, on the same weekend, on Sunday, I started coughing, I started sneezing, everything was just getting worse, real bad. And my mom came upstairs and she checked up on me, and she was checking my temperature and stuff and saying that I gotta probably get tested most likely, because it started getting worse. And then as the day went by, I just started coughing more, sneezing more, everything was getting worse. And then the next morning, which was the Monday morning, getting ready for school, I was done ready for school, and I went back in my bed to lay down for a little bit. I went to sleep for a little bit until everybody was ready. And then when I woke back up, I was barely able to move, and I texted my mom. I asked her to come in the room and could you bring me something to help my muscles and my bones and everything? It's like some, muscle relaxer or anything. And then when she seen the message, she just freaked out and she was like, we gotta go get tested and make sure everything okay. And that's when I found out the news and I looked up what I had.
So at first you thought it was maybe from like football training and all that.
Yeah, at first I thought it was just soreness or something from the football training, maybe out of shape or something. But then it was getting bad, like real bad.
Yeah.
And I ain't never feel like that before. So.
And the symptoms you said you was going through was coughing. What else?
Coughing, sneezing, headaches, a runny nose, and a stuffy nose, and of course the pain aches of my muscles.
What was the worst symptom to you in a sense?
Definitely the pain aches, like the muscles. That hurt real bad.
On a scale of 1 to 10, how bad do you think it affected your body?
Probably like an 8.5 or a 9. It was real bad.
You ever went through something like that before in your life?
Never ever.
Okay.
It was something new, and I was so confused.
Did you ever go to the hospital?
No, I never did. I just stayed home and just stayed in my room and hopefully, try to get some movement around and try and get myself back to normal.
At some point, did you take like any medicine, any pills for the body pain, anything like that?
Yes, I think my mom ended up going somewhere and getting me stuff, to try and help myself. She called my family. She called, as much people as she could to try and, find some people that probably experienced something like that. And she tried to just look up researches and things that could possibly help me. So yes, I did end up, taking things.
I know you wanted this pain to go away, so do you feel like this kind of like made you tap in more with God in a sense? Like,
yes, it definitely did. And what was crazy about it, not only did I try and, pray more for myself, but it made me think about other people that maybe was going through this or even worse or, even less of what I was going through. No matter what, it still just made me want to pray for everybody and make sure everybody was okay. No matter if they had what I had or if it was worse than what I had. It was just crazy. I don't want nobody to go through anything like that.
Yeah, that's real. I was going to say, so how do you think this affected your family in a sense? Did they feel like hopeless, like being that they couldn't do anything about it or anything like that? How do you feel like it affected them?
I feel it definitely did probably make some people feel helpless or hopeless. It did, but which was really, hard on me because even though it's something that I can't control, it was, something that was going on with me that made them feel that way, which really just made me, in a weird position. I didn't really understand, it was just a little sad, just feeling down that what was going on with me was really affecting like a real big impact on my family.
Yeah. Okay. Your mom mentioned to me one time that you heard her crying, you feel me? And she told me that you sent her a text saying that you was going to pull through. What was going through your mind at that time? Like, what was your biggest fear in a sense? Did you have any big fears when you was going through this?
Yes, I only had two, which was really the main one being not being able to like get myself back to regular, as like my legs and my arms not being back fully how they were and staying in that position or getting worse or being hospitalized. Like my mom, she showed me an article, she sent it to me, and it was a lady, and she was not paralyzed, but she had to go to the hospital and get surgery because she had what I had, but it was even worse than what I had. It was way worse than what I had. And she had to go get surgery, but everything was okay. She pulled through, and I think she's doing better now. And she had what I had, and it was way worse.
So your mom, she was a big help for you during this time.
Yeah, she was definitely the most helpful person. She was taking care of me, make sure I ate, make sure she gave me the right things to help myself. She helped my showers. I couldn't really move around, but she definitely helped me, and I was, getting back better.
Are you vaccinated?
No, I'm not.
And how it felt going back to school? You felt like everybody showed you love when you went back to school? Or
Yeah.
you feel like people was avoiding you in a sense?
Nah, people wasn't avoiding me. Everybody really missed me, cause I don't know. People really miss me like that. Everybody was missing me. So yeah.
That's real. So with the sports, like what position like you really like?
I like
your favorite position.
Like for football, I like playing wide receiver, and for basketball, I like playing point guard.
Oh, you feel like you gaming?
Yeah.
Yeah, we definitely gonna see about that then.
More than that, I'm Curry. More than that.